everyone, welcome to SCube TV. I am your host Rajni Bharara, and today on the show I have with me a very special guest. His name is Dr. Virinchi Sharma. He is a psychiatrist. So today on the show we are going to speak with him about psychotherapy and also about mental health. But before, let's welcome him to SCube TV. Hello, Dr. Virinchi. Welcome to SCube TV.
Thank you so much, Rajni. It's surely an honor to be here and very excited for the show. Thank you.
Of course, it's a pleasure having you on the show, and thank you so much for taking out time and doing the show. So, Dr. Virinchi, I just would not like to waste any more time, and would directly like to start this session with my very first question. So, when I talk about my first question, so it is actually about what exactly is, oh, I mean, not what, but who exactly is a psychiatrist? Because when we talk about psychiatrist and a person being a psychiatrist, there are too many connotations attached to that particular word psychiatrist, because then people think that the pendulum thing, I'm not getting the word that happens.
Hypnosis.
Hypnosis, yeah, yes, hypnosis. So people, the psychiatrist also does that, and then they help with mental health. But you as a psychiatrist, what exactly does a psychiatrist do, and who exactly is a psychiatrist? If you can please explain to the audiences.
Well, thank you so much for this question because I do understand that a lot of people get confused between what a psychiatrist is, or probably sometimes what a psychologist is, or what a
Yeah.
clinical therapist is. So, me as a psychiatrist, I'm a medical professional. So, a psychiatrist has a qualification of an MBBS. So, we do the basic sciences, the Bachelor of Medicine, Bachelor of Surgery, where we study starting from the anatomy to the physiology to the chemical changes to the pathology of the entire human system. And then we specialize in one particular field. Somebody could be specializing in the heart, and they're
Yeah.
cardiologists. Somebody specializes in children, they're called as pediatricians. So, similarly, that one field that deals with the brain and a lot of ingredients of the brain, not just the structure of the brain, but the chemicals inside the brain called as neurotransmitters, the hormones inside the brain, the neuropeptides, and how all of these affect an individual's behavior, affect an individual's emotions, affect an individual's perceptions, as well as affect an individual's thoughts. So, thoughts, emotions, perceptions, and behaviors are basically the dimensions of the human brain that are dealt by us who are psychiatrists.
Okay. Okay. But yeah. So great, you have explained it very well. I mean, about who exactly is a psychiatrist and what exactly does he do. But now I would like to talk about uh, psychotherapy. So what exactly is psychotherapy and what goes into it? If you can also please explain that.
So, well, when it comes under the umbrella of mental health, we have three categories of people. One, a psychiatrist, two, a clinical psychologist, and three, a counselor. So now, what do we deal with in this, under this umbrella called mental health? So one, like I said, because we deal with these few dimensions called as thoughts, emotions, perceptions, and behaviors, any abnormalities in these dimensions is dealt by mental health professionals. So now when we are dealing with these, we deal with it in two ways, broadly classified into two ways. So one is a pharmacological therapy, that is a medical therapy, where we are trying to give medicines or injections, where we are trying to bring about a balance in those chemical changes that happen inside the brain. And the second type of therapy, also called as talk therapy, is scientifically called as psychotherapy. So under psychotherapy, it's very different than talk therapy, though it is commonly called as talk therapy. What a lot of people think is, just talking brings about a change. But
Yeah.
it's not just about talking. Undoubtedly, we need to do a lot of talking because we need to understand the individual. We need to create that rapport with an individual. We need to create that confidence in an individual. And once all of them are established, then we start working on some core concepts of the brain, how an individual's environment has brought about changes in his life. Like somebody who grew up in a harsh environment could be having some particular personality issues. Somebody who grew up in an environment where there was a single parent could be having some particular personality traits. So, similarly, different situations, different environments how they deal upon an individual, trying to identify them, trying to find out where the person is going wrong, and trying to suggest him how to look into bringing about changes to correct all these issues that have been happening inside our brain is what
Yeah.
we exactly deal with in psychotherapy.
Okay, okay. But then how long does it take and how many sessions does it take to actually help a person with, a better mental health situation?
So now, when an individual initially comes to us with a particular mental health issue,
Mm.
the first important thing that we do is taking a detailed history. Because now, suppose if there is a 25-year-old girl who comes down to me, I need to be knowing maximum details about the last 25 years. Probably, about her childhood, her family could be sharing me, about her growing age, her siblings could be sharing with me, about the last few years where she's very conscious about what has been happening with her. She could be sharing with us. And this whole history that we accumulate becomes the history. And now then we start our mental status examination. This is the typical examination what a mental health professional does, through which we come to a probable diagnosis. So I could be at the end of the examination saying that she might be having a depressive episode. So now next what we do is we go into assessments. So in simpler words, assessment is something like a laboratory test that your physician asks you to get it done.
Mhm.
Suppose an individual goes to a doctor with fever, the doctor says, why don't you get your CBP done? Why don't you get your malaria test done? Why don't you get your typhoid test done? So similarly, something that can be more accurate in helping us understand are these diagnostic tests. So here we get a score, which makes it all the more easy for us to understand. Because when I tell somebody you have depression, he says, how
Yeah.
severe is my depression? What is the value of my depression? So
Mhm.
now to categorize it into either mild or moderate or severe or very severe, we use the assessment. So now
Mhm.
finally the history taking is done, the examination is done, the assessment is done, and now we are here sitting with a score which tells me that this person could be having a moderate depressive episode, a severe depressive episode. So now here we decide what therapy is suitable for him. So if
Okay.
you look according to the international guidelines, mild to moderate levels of depressions or anxieties or phobias or OCDs or sleep issues
Yeah.
or eating disorders. So we call all of them as neurotic illnesses. So the whole psychiatry is divided into neurosis and psychosis. In
Mhm.
simpler words, a person with neurotic illness comes to you directly and says, Doctor, I have a problem.
Mhm.
A person with a psychotic illness might not understand the typical madness that we call.
Mhm.
So now somebody having a neurotic illness will come to you and then you do the assessment. And then when it is at a mild to moderate level, we start with talk therapy instead of the medical therapy.
Mhm.
And coming back to your question specific, the number of sessions that it usually takes is 12 to 16 sessions to bring
Mhm.
about a change. One simple dictum that I always tell all my patients is the change does not happen in the session. The change happens in between two sessions. So today we had a session. I'm going
Mhm.
to tell you what we need to bring about in the next 1 week. So if you religiously go practice everything that we've discussed, by the next time you come, you start seeing the change. The
Yeah.
reason why I'm saying this is people believe that it is going to be a magical thing at the end of a session, oh my God, I'm enlightened. It's not that way.
Yeah.
Undoubtedly, after a session, you are motivated by us. You are given that energy which helps you to go work upon your issues. But a lot of efforts should be coming from the patient side, and that is when we see the perfect results.
Okay, okay, great. I'm really sorry about my cat if you're a bit distracted. I'm really sorry about that. But I actually would like to move to my next question. So, you actually have explained it, I mean, in a great way, how psychotherapy and how long does the session take actually. But when recently I actually had a session I spoke with a mental health trainer. So she herself went into a depression, and then, that's how she became a mental health trainer, and that's how she trained people who were suffering, who were going through these problems. So she actually told me that, in normal lives, what the reason is that people normally have this idea of saying mental illness as mental health, whereas mental health is exactly as physical health that everybody needs to be better at. Like, you need to be better at your physical health, exactly. In the same way, you need to be better at your mental health too. But when we speak about mental illness, we call it mental health. So you, as a psychiatrist, would you say that people are being a bit ignorant towards the kind of language that they're using?
Well, now see what happens is, one, understanding when, a particular dimension of your health is going towards abnormality is what we need to know. Like, for an example, to put it in simpler words, sadness is a common emotion. Sadness is a part of your brain.
Yeah.
I've given an exam and I didn't get the result that I expected. I feel sad. I cannot really celebrate. That would be abnormal if I start celebrating when I fail in my exam.
Yeah, exactly.
But now, the ability to cope up from that particular situation and move forward is exactly mental health. So, in any given situation, during a stressful life event, the ability to cope up and bounce back and move forward is, what defines an individual's mental health or a positive mental health. Now, when that individual is lacking that ability, and because of lack of that ability, if that individual is being dragged into the past, not letting him go forward, not letting him move away from there, and somewhere it starts affecting his entire system, starting from his biological functions like sleep and appetite, starting from his professional abilities like ability to focus, concentrate, ability to memorize things, ability to use his higher mental functions like judgment, like decision making, and somewhere it starts affecting his personal life. He's not able to have that emotional connect with his spouse, emotional connect with his family members. He's not able to have that physical relationship that he normally has with his spouse or a partner. Now, all these dimensions, when they start getting affected, then we call it as an illness. So,
Okay.
I do understand that sometimes these mental illnesses are underrated, as well
Okay.
as sometimes normal emotions are overrated. Now, when I start feeling sad, somebody tells me, अरे यार तेरे को डिप्रेशन हो गया.
Yeah.
और जब मुझे सच्ची में डिप्रेशन होता है and I tell somebody I'm depressed, they're like, it's all fine. I was also depressed once upon a time.
Yeah, so you're basically saying that people are, in today's time, people are using words like depression, anxiety, OCD, at the drop of a hat. So people are,
Absolutely.
okay, so they should be more conscious about these things, and they should not use such, heavy words in their regular lives.
True. I mean, see, because depression is a diagnosis. Now,
Yeah.
what happens is, I'll try to explain. Suppose if I am feeling sad and I start telling somebody that I'm depressed.
Yeah, just give me a second. One second. I'm really, really sorry about it.
No,
Really
no,
sorry.
it's absolutely fine. It's absolutely fine.
Yeah. So
So,
yeah,
I was trying to say, suppose if I am sad and I call myself as having depression, and I meet somebody who's actually having depression.
yeah,
Now, tomorrow, if I bounce back from that sadness and I'm all fine again, and I say I'm feeling better, now the other person might start feeling that his illness is way too serious because he's not able to be like me.
yeah,
And at the same time, uh, what happens is, somebody who's into sadness, for an example, the common things that I see, a youngster fails his an examination, feels sad for 2 days. Then one of his friend tells him, "Arey kuch nahi yaar, let's go have a drink." And now he has a drink, and there is some gyan that his friend gives him, and all of a sudden he starts feeling all overwhelmed, and he says, "Oh, I'm fine." And now the person who's actually depressed starts feeling that probably alcohol is the solution. So
yeah,
somewhere there is a lot of danger in using these words, like you said, on the drop of a hat. And sometimes when we overuse these words, when someone really has that issue, we don't emphasize that issue. We just brush it off. And
yeah.
that is also somewhere bad. So, sometimes, the whole Bollywood also, who stands up and speaks about mental health, use these words in their movies. Pagal hai kya? Pagalpanti. There was a movie called Mental Hai Kya, which was again, fought and, changed into Judgmental Hai Kya.
Judgment.
So, somewhere Bollywood, which looks like very supportive, also is very insensitive when it comes to mental health. The reason why I'm talking about them is they are, idealized by a lot of people. They are looked upon by a lot of people. So,
So true.
somewhere responsible people should be using these words all the more careful, and every individual also should be educated about using these words, which makes mental health diagnosis and treatment much more smoother than what it is.
Yeah, yeah, absolutely. Yeah, so true about the Bollywood and the Hindi cinema scenario. I think in today's time, people are using these conversations and raising these topic not just to spread the awareness, but also to make money and make business out of it. Yeah.
Absolutely, absolutely. Unfortunately, I see a lot of people with a YouTube degree and an Instagram degree also promoting mental health, and that's wrong. It's as wrong as, all of a sudden I tell somebody I'll cut open your stomach and I'll operate your intestines. When
Mhm.
I'm not trained with it, I shouldn't be doing it, because
Yeah.
the damage that I would be doing is more than the benefit.
Mm-hmm. Apparently, the thing is, apparently everyone is, aware and so much knowledgeable about mind and all these things. I think in today, especially in today's time, and especially, at the time of being in social media and being a influencer. So people have this thing about spreading gyan and telling people about you should do this, you should not do this. So they are also have, they also have become the mental health coach and a psychiatrist apparently in today's time. So, but Dr. Virinchi, I also would like to know that, it is said that, I mean, is this what I am saying? I don't know if it is said or not, but I have actually heard it that psychiatrists can read mind. So, can they?
We cannot really read the mind,
Okay.
but we can surely help somebody to express what's happening inside their head. Because now what happens is, especially during an illness, there is a lot of confusion that happens inside the brain, and because of that confusion, the clarity of thoughts are disturbed. Emotions are unstable,
Yeah.
behaviors are erratic. So we can surely help them explain or express their underlying issues. We can surely make it a little more transparent for them that it is actually affecting their day-to-day life. Because a lot of times, somebody's quantitative life might not be getting affected, but the qualitative life gets affected.
Yeah.
So when it affects the quantity, it is easy to understand. But when it affects the quality, we might not be able to understand that. So
Mhm.
somewhere in that way, we step in to bring down that clarity into somebody's understanding of their illness. But surely reading minds is only a concept left to Netflix and Amazon.
Okay, okay, great. So, but also, but it is said that a psychiatrist can at least notice your behavior and can know with the kind of behavior that you are having, or the kind of postures that you are using while you are speaking with someone. So they can actually tell what is going in your mind and what you're feeling actually going through. So, when a person is actually mentally ill and is going through certain phases in their life, I'm actually talking about mental health. So, what behavior should we notice? And if that person is not able to tell us, and if the person is, a bit hesitant to actually accept it and accept the fact that they are going through these problems, so what, as an individual, should we look in that particular person in their behavior to tell them or to actually make them realize, so you are going through these changes, so you should be, you should now consult to a psychiatrist, or you should go see a psychiatrist and you should take a session with them.
Right. I think this is a very difficult question to put it in very little words, but I'll still try to put it, because there is a variety of illnesses that we deal with, and each illness has a particular presentation. But otherwise, also, the major dimensions that we should be looking at is first physical, mental, and social well-being. This is the definition of health. So if somebody is physically fine, mentally fine, and socially fine, that is when we call them healthy. And if any of these dimensions start getting affected, that is when we should be thinking that there is something unhealthy about them. And when
Okay.
it comes to mental health specifically, the few dimensions that I would like to look into is one, the biological functions. Like I said, if somebody's sleep or somebody's appetite related behaviors are getting disturbed, like somebody could be telling you, I'm not really able to sleep well. That could be the only presenting issue. Somebody
Yeah.
could be saying, I hit the bed by 10 o'clock, but I don't get sleep till 2 in the night. Or somebody could be saying, I fall asleep, but I get up many times. Or I'm wide awake 3 a.m. So, somewhere, a change in the biological rhythms of sleeping habits or eating habits could be a warning sign of something happening, inside the brain. Next, looking into their professional lives. So, somebody who's energetic suddenly starts feeling lethargic. Somebody who used to be always within people loses interest in the best of the activities they do. Like someone who used to like to enjoy to go and play tennis in the evening, now all of a sudden is sitting inside the four walls, not wanting to meet people, not interested in making new friends, not wanting to go out to watch movies, not spending time with family. So somewhere when his personal, relationships are getting disturbed, or his professional abilities are getting disturbed, like easily getting distracted, not able to focus. A lot of times we do notice this in our work, when we see somebody who's not having the right attention, not focusing, losing concentration, lost in some thoughts. So, all these somewhere, like I said, the biological changes, professional changes, personal changes, changes in their social interactions, the way they used to interact, all of that comes less or becomes less. So all these dimensions are something that we should always be noticing. And like you were talking, you were telling about how a psychiatrist understands, through somebody's behaviors or postures. This is exactly what we do in our MSc, that is the mental status examination. We
Okay.
observe every minute detail, even from if the individual is trying to maintain an eye contact or no, how the thoughts are, how relevant the thoughts are, how is the flow of thoughts? Are they like really shifting from one thought to the other? How is their mood while they talk to us? Is it being stable or is it very unstable? And are they perceiving things around them fine? Somebody could be having hallucinations where they
Yeah.
perceive abnormal things. Somebody could be having delusions. So we try to look into each aspect from how they talk, how they walk, how they express, and normally also all these dimensions are something that we should be looking at. And if we find a disturbance in any of these things, I think that is when we should be asking them if they really need some help, if they have been doing fine. And always asking an open-ended question is better than asking a closed question. So, open-ended question helps them to express more about themselves. And before that, I think we should be able to create that comfort, even if it is our own friend. For
Yeah.
them, all of a sudden talking about their mental health might look like a stigma. So
Mhm.
first, giving them the comfort, giving them the confidence, telling them that probably they themselves have faced something like this, or they know somebody who's faced something like this, and there is help in regards to these issues, and then gaining the confidence and trying to understand is something which all of us should be well equipped with. This is something very important which all of us should be trained with. Especially, I'm saying this because we see a sudden increase in the mental health issues in the last 1 decade.
Yeah.
Yes, sudden spike in mental health issues, especially in the last 2 years from the time COVID has come.
Oh,
So
yeah. True.
these knowledge about all of this is a must in today's world.
Yeah, absolutely, absolutely. But Dr. Vinci, also, when we actually come to know and when we realize that a family member, a friend, or a sibling is going through such problems and such phases in life, then what should we, as a friend, as a partner, as a parent, or as a sibling, should do for them in the home environment? I mean, at the home level, what can we do for them?
I think the most important thing is to give them a shoulder to cry on, or a ear to listen to, because a lot of times these people have been piling up a lot of emotions which they are not able to express, and I say that, venting out emotions is as nice as how a schoolboy would feel when he would come back home and get that heavy bag off his
Yeah.
shoulders and put it aside. So the kind of relief that that boy gets is exactly what the relief an individual gets when they vent out their emotions. And being non-judgmental, listening more to them, not jumping into conclusions, and telling them that this is a phase and this is not them, this is the illness inside them, is going to boost a lot of their confidence. Secondly, suggesting them that there are mental health professionals who could be dealing with this and trying to destigmatize the whole mental health issue. So, a lot of times when youngsters come to me and they have a diagnosis, and when I have to tell them, I do see, them worried about being, labeled with a diagnosis. So, the simple thing I always tell them is, if I buy a new car and I never use it, if I keep the car only in the garage, the car would never get any repair.
Yeah.
But when I start using the car, there would be services that the car needs. The car
Mhm.
regularly needs fuel. The tires get worn out. So it needs repairs.
Yeah.
So similarly, it is with the brain also. When you're not using your brain, there are no repairs. When you use your brain, there are repairs. So we should never shy off thinking that I have a mental health issue. You should proudly tell yourself that I have been working, my brain has been working, and there are repairs. It's something like if I sit home and watch the India versus England cricket match, I will never get an injury.
Yeah.
But when I go onto the ground and I start playing, I will start getting injuries. So injuries to brain are as common as physical injuries, and repairing these injuries actually is going to improve a lot of their life. So destigmatizing by saying such examples or saying these things is actually going to ease them to come down to a mental health professional. And once they come to us, we follow a pattern, a proper systematic module where we educate the patient first, we try to educate the family members, and then we start off with some treatments. So all of these things can be done in a simultaneous way.
Okay, I mean that's a beautiful, beautiful way that you have actually, shared your thoughts about them. And the thing that you said about the physical injury and mental injury, I absolutely loved it, and I'm sure the audiences too. With this, before I let you go, Dr. Virinchi, one last question. So, what as a psychologist would you say about meditation and spirituality? Because we also say that if you practice meditation daily, so it would help you in getting getting stress relief, and it will help you in making your mental health better. So would you as a psychiatrist recommend it, and does it actually work?
Can I talk an extra minute on this?
Of course, would love to.
So, when we talk about spirituality, spirituality is surely a wing of psychiatry. Uh, Even the Indian Psychiatric Society has recently introduced the spiritual wing. And when we talk about, huge establishments like the Royal College of Psychiatry, they have a spirituality wing where there are almost 3,000 doctors who are working on this. Just a second, please.
No problem, please. No problem, no problem.
So, so we have a spirituality wing in all the countries which work on mental health. And if you look at the World Psychiatric Association, they have very clearly said that spirituality and religiosity are very important aspects which help in treating an individual. So even if I am an atheist, I should not devoid my patient from spiritual gains.
Wow.
So
Okay.
something which the World Psychiatric Association also has said. Now, undoubtedly, yoga, meditation have been proven on utmost platforms, like international platforms, because people believe that yoga is something which is originated from India or the Asian countries, so probably that's why we practice it. But that's not true anymore. Even on scientific levels, people practicing yogas, brains have been studied and they have seen some functional, structural, chemical positive changes inside a functional MRI of the brain, which surely says a big yes to yoga and meditation. But there is one clause I would like to bring it here. We
Mhm.
all know that jogging and running is a very good exercise.
Yeah.
But what would happen if somebody with a broken leg runs? It would worsen the injury.
Yeah.
So, undoubtedly, practices like yoga, meditation are helpful in protecting somebody from having a mental health issue. But
Mhm.
when somebody is having an acute mental health issue, I wouldn't immediately suggest that. I would say let us give rest at this point. Let us recoup the brain through other techniques and gradually introduce it back. So that is the only one clause that I would say where we shouldn't immediately jump into, because I see a lot of people who come down to me and have said, "Sir, I know I have a mental health issue, and I saw somebody telling me do meditation, but that meditation worsened my mental health issue."
Okay.
So it's like running with a broken leg.
Yeah.
So somewhere, when we feel that there is a mental health issue, always getting it screened and getting to know at what level the illness is, and
Mhm.
then looking into practices is something that is good. Otherwise, if we feel that there is no mental health issue, it is just basic stress that I have. Undoubtedly, these breathing techniques are very helpful. Not just yoga, not just meditation. There are some relaxation techniques that we use in psychiatry. Physical activity has been known to boost these chemicals. There are some dietary changes that we use. Sunlight therapy has been very helpful. So a lot of lifestyle changes that we can bring in can actually prevent an individual from having mental health issues.
Wow, wow. Thank you so much. Thank you so much, Dr. Virinchi. I mean, so as you would conclude, so would you like to, conclude by saying that spirituality and meditation can lead to positive mental health?
I would like to say, undoubtedly, spirituality and religiosity, both of them have positive effects. So we should never undermine these aspects. They have been scientifically proven on platforms on these particular. When we are sitting here on 2021, they have been already scientifically proven. So undoubtedly, these practices are a big go-go in protecting mental health. So I would totally recommend people get into these good habits.
Wow, amazing, amazing. Thank you so much, Dr. Virinchi, for coming to SCube TV and speaking with us. It was such an amazing conversation that we had, and I thoroughly, thoroughly enjoyed it. And it was so much knowledgeable too. So thank you so much for coming and doing the show.
Thank you so much, Rajni. It was a pleasure being on the show with you. Thank you.
All right, guys, that's it from SCube TV. Keep on watching and do subscribe to the channel.